This is the side-lying lumbar stress test. In my opinion, this is the most sensitive test we have for picking up instability at lumbar spine segments. We're particularly looking for abnormal amounts of translation here of the lower on the upper segment. And the way in which we'll do this test is we'll have the patient bring their hips and knees up to roughly 90 degrees. Their top arm will be using the loop fashion again. And your middle finger or your index finger, whatever you're most comfortable with, will palpate between the interspace of the segment that you're trying to treat or you're trying to assess. The patient's knees will be against your upper thigh, and the test is then performed by maintaining a relatively solid fixation at the hands and then pushing through the long lever of the femurs in this direction. This is not an abrupt, forceful movement. This is a very gentle movement at early range, looking for an increase of translation in that initial period. An increase in translation, either accompanied by pain or accompanied by an increased range of motion, may be indicative of a stability test, a stability issue at that segment, particularly if it matches up with subjective findings, other objective findings, and findings with the neuromuscular control of the multifidus. If that test is positive, and we can certainly do it at each of the levels, there's a couple of things we can do either to further our prognostic indications or to rule in or rule out. The next thing we would do is tighten up into full flexion. And what this does is increases the tension on the posterior chain and the thoracolumbar fascia to tighten that posterior chain, which would significantly decrease the translation available. We would then retest by pushing up longitudinally through the femurs, and we would expect to see less movement. If we saw more movement, then we would be suspicious that there's a significant restraint problem in that area, which significantly changes our prognosis for the worse. The final step in this is to go back to the original position and repeat the test with the patient bringing in the transversus abdominis musculature. So we'd have them gently draw in their abdomen, and we would push posteriorly and hope to see decreased translation. If in fact we do see decreased translation there, that is a good indicator in my mind that the application of a segmental stabilization program would be very useful to us in decreasing the patient's translation and therefore his symptoms.